So, we okay? I'm gonna say good morning. Am I okay?
Good morning.
I can't say good morning now. Okay, I'm glad to have everybody here. And what I'm gonna talk about is some things that came to my attention last night while I was treating a newborn infant. You know, young mothers and old mothers who are new mothers, new parents, because I was in that position as a new parent. When you have a baby, in particular, if you have a baby that you've waited for a long time, an adoptive child, it's just, and you get that kid for the first time, you just want to do everything perfect. And so, what happened last night is that one of our newborns in our practice wasn't doing well, and the mother called and was panicked. And she was panicked because they have a wolf, a full, beautiful timber wolf, and the baby was swinging back and forth on one of those little baby swings, and the wolf came over, and now this is the first chance this wolf has been meeting this baby, and greeted the child and licked the baby, and in that process the tooth of the wolf got into the head of this newborn infant. Didn't pierce the skull or anything. It wasn't an official bite. It wasn't an attack. It was just a little accident, okay? So now the child has an open wound. Well, that was the only description of it that I had over the phone. And she had already gone to the doctor. The doctor called the CDC, if you can imagine the circumstance, because he's never had this situation with a child that young. The CDC said, no, don't do a tetanus. I don't know why they would think of doing a tetanus, but that's okay. And then the CDC said, yeah, you can go ahead and put them on Augmentin. They put this child on Augmentin at 1 month old. Okay, so now I'm telling the mother, look for diaper rash because we're talking candidiasis here. And I haven't seen this puncture wound. Don't use the laser on it. Remember what we said about puncture wounds, okay? So if there is anything entrapped there from the saliva of the animal, you don't want to close that up. So they've been trained by me to do emergency things at home for themselves, but in that sort of situation, without seeing this child, that's what I told them. Well, last night she called up, she was desperate. So I said, okay, this is now the child's been on this stuff for about 5 days. So now we're in the throes of dysbiosis, full-blown candidiasis. And she said, it's a bloody stool. My baby's passing a bloody stool. So I said, all right. And I met her, and they have a van, so I treated the child in the van. One of the other things that this mother was concerned about was that now the 10 days the umbilicus came off, and this baby's got an outie belly button. She was like, I don't want this kid to have an outie belly button. Everybody's going to pick on it, you know. The things that people think about with their kids, all those kinds of things. So I said, okay, all right, fine. And I had the Q1000. And I treated her to a little bit of the, you know, we did this very sanitary way, the little diaper. So whatever was in there, if we could catch some of the candidiasis, that's what I was going for, okay? We ran the points that you've learned here and treated the baby in that way. And then I treated the abdomen, okay? All up, following the descending colon across and down. Then I treated directly over the small intestine, all right? Those are some of the things that I did. In that process, I pulled the belly button in like that, and she now has a real nice looking, feminine looking belly button, okay? The first scar, the very first scar to treat is the umbilicus. And I forgot to mention that to you. And the conception vessel comes right through it. All right, so we did a lot for that child. That baby's abdomen with palpation was rock hard. Oh boy, that child was not doing well. And so with candidiasis, and with flu viruses and with bacteria, the wave front of the laser will help with all of those situations. So, and then I had another learning experience that I have to share with you. On the way here, I had a teenage boy throwing up in the back of my car, and that was just such a joy. So, but I had Nux vomica with me, which is a homeopathic of choice. In that circumstance. But I know from experience that if a child is throwing up or an adult is throwing up, you don't want to give them Nux vomica because they're going to throw up anyway, you know. And so we have to have a way of dealing with this. And you know, I had the tools. I had the Nux vomica and I had the laser, and guess how I could get that into his system quickly?
Your skin?
By irritating them.
Yeah, but where in the skin?
Arm, someplace.
Right over the vein and arteries at the wrist, okay? And you can put it on the homeopathic, you know, the acupuncture points. You hit the laser there, you do laser pheresis, hit it here, do the laser pheresis. Then as soon as I could stop and I got a chance, I did the laser over all the vagus nerve, okay? And he's saying, what is that? What are you doing? This is, oh, I feel better. And he's leaning into it, you know. So we stopped the vomiting, and he's going to be okay. Now I'm going to tell you about seizures with children, and I'm going to demonstrate on my own child, and I hope you aren't going to be upset by this. I'm going to induce a mild seizure in my son, and then I'm going to correct it. I'm doing this on purpose, and I'm doing this for the sake of other children and that you might be treating, okay? You need to know that you can induce seizures in children with a history of epilepsy. You have to be careful about how you do this. You also need to know that you can make a huge difference post-epileptic seizure. Now, what you're going to see with my son, he has temporal lobe seizures related to neuroborrelia. All right, so we're still fighting Lyme disease with him. Kids with Lyme disease look like they're ADD, they look schizophrenic, they look hyperactive, and all of this stuff changes. And it's how the Lyme disease and the spirochete affects them neurologically. Lyme disease is very similar to syphilis. They called syphilis the great pretender. Lyme disease can look like arthritis, it can look like fibromyalgia, chronic fatigue. It's a phenomenal, horrible disease. Fascinating disease, but horrible disease to survive and live through. And I can tell you it's one of the top misdiagnosed diseases in this country. You can't imagine what we had to go through to find somebody to help us. Even though I had some lab work, not the classical lab work because that's so inaccurate, gives you so many false negatives. I had other lab work proving that we had it, and I couldn't get anyone to listen. My son actually had a seizure in a pediatric doctor's office, and I told him, if you have my son, if you leave him sitting here and he's chilled like this, he's going to get he's going to have a seizure. And of course, the doctor walks out, nurse comes in, my son has a seizure, calls the doctor. I said, get the doctor. Doctor watched him, and I said, this is neuroborrelia. This is what you're seeing. They still wouldn't give me anything. So, and of course what I was looking for at that time, what I desperately needed was the antibiotics, the tetracycline family, doxycycline. I eventually did get a subscription, and Dr. Whitaker down in Tampa, Florida area, she's 77 years old, God bless her, she has made a huge contribution to fighting Lyme disease. And she developed the test that will give you the most accurate information for diagnosing Lyme disease. So at some point I can talk at length about Lyme disease. I just want you all to be aware it is here in Georgia. And if you have chronic patients that you haven't been able to figure out and you haven't been able to help, one of the things that you can give them is Samento, which is a fabulous herb. It's a special form of cat's claw. Samento. And Dr. Rod on a break will show you. We have some here at the office. You have to dose it very carefully, and we can give you a page about how to go about dosing it. But if you catch Lyme disease, you can help manage that tremendously. Some of your patients will need to be on antibiotics. Okay, and I don't recommend antibiotics lightly, but that is a terrible disease.
Oh, I don't think so.
Stand here. I want to introduce you to the doctors, all right? Are you all right? I know, I'm sorry. He left. All right, this is my son, Nicholas. Can you say hi?
Hello.
All right, and you remember Dr. David? Okay, good. Tell people how old you are.
I'm 10 years old.
And when's your birthday?
December 3rd.
December 3rd. So you're going to be?
11.
All right, very nice. All right. And Nicholas, what I'm going to do for a second, you weren't feeling well earlier, were you?
No.
Can you explain what happened? Can you explain what happened? No? Can't talk about it? All right. Do you mind if I use you for a patient for a second?
No.
Is that okay? Okay, so I got your permission? All right, good. What I'm going to do is I'm going to put this Oh, wait a minute, let's do something. Stand with your feet together and stick your arms straight out like a zombie for me. That's nice. All right, stand up nice and straight. And don't put any effort into this. Relax the back of your... That's nice. Now put your hands forward. All right, now here. Just keep your head straight. All right, here. Take this finger and real slowly touch the tip of your nose, dear.
Is my eyes closed?
Yeah. Not too bad. Switch. Do the other arm. Not too bad. Okay. Can you do a heel toe walk like you're walking on a straight line? One foot in front of the other? Put one foot, no. Touch your heel to your front toe, like you're walking on a tape. That's it. Bring it all the way forward and touch your back. Here. That's it. One foot right in front of the other, like this. Move it over. Look, watch mommy. Watch mommy.
Oh, that.
All right. Okay, walk towards Madison. That's nice. All right, so you see, he's got some discoordination here. Okay, good. We're gonna see about making it. Maybe better, maybe worse. He's had a seizure this morning. And what you'll see with Nicholas's affect after a seizure is you'll see age regression. That's the primary way that it comes up. Nicholas is a very well-spoken child. And normally a very well-behaved, cooperative child. How you doing?
Feet are freezing.
Anything else?
No.
Well, you might have just been depolarized enough that we're not going to get a response. All right, at this point, we're just going to go for fixing him 100%. What am I doing here, guys? And what does that do? Stellate ganglion, what does it do? Why is it important?
Blood nurse by neck throat.